Hey everyone, my name's Sarah Lavonne and welcome back to my YouTube channel. One very common complaint or pain that many pregnant people experience during their pregnancy is called round ligament pain. Maybe you've heard of this before. Maybe you felt a sharp, stabbing pain in your lower abdomen during your pregnancy. It can be super concerning and concerning enough that it might actually send some people to the hospital. But have no fear, this is actually super normal for pregnancy, but it's really important that you're able to distinguish between this normal change in your uterus. I'm gonna give you some tips for how to fix it too, and then between actual labor or something to be concerned about. And so before I alleviate all of your concerns, make sure you subscribe down below, and then let's get started. Before I give you some remedies for your round ligament pain, I want you to be able to identify what's happening in your body. So throughout your pregnancy, you have your uterus that is the main muscle that houses your baby. That's where your baby grows inside. It normally starts out about the size of your fist. So I am currently not pregnant. My uterus sits deep in my abdomen, like towards my pelvis or my pubic bone, sitting nice and low. Like imagine my hand without the sweatshirt situation is my uterus, okay? Just like all of your organs, if we didn't have supporting structures around them, all of our organs would basically just like flop around in us, right? We need something holding us together. And so some of that might be your muscles, that's definitely your fascia. That's a whole nother video. I could talk about fascia all day long. If you want it, let me know. Or it could be your ligaments, which is what we're gonna talk about today, or even just your tissues, your skin holds us together, right? And so we want to be not a floppy person, right? We wanna be solid. And so our body kind of has all these ways of holding us together. Now, specifically related to the uterus, we want our uterus to sit there and not flop around. First of all, that would be really uncomfortable. And then you think about a uterus that then gets pregnant and starts to fill the abdomen up. If this uterus didn't have some help with it, it would just kind of flop around and that would be really uncomfortable. Maybe towards the end of your pregnancy, you see pregnant people kind of holding the bottom part of their belly. That's because all of the supporting structures around the uterus are super stretched out and they may feel kind of weak, like a rubber band that's been stretched out for a long time. It starts to get kind of like flimsy. So you may need some extra support. Total side note, this is where a support belt can come in to help you out, all right? So what I wanna talk about today is specifically our round ligaments, because so often in the hospital, I will be triaging a patient. They'll come in with what they think is contractions or some pretty severe discomfort, specifically in their lower abdomen, kind of in like where your leg hits your like groin area, or in the lower abdomen. Any time throughout the pregnancy that comes and goes, a lot of times it feels pretty deep. It might feel really sharp where you're like, oh wow, that came on out of nowhere. It might feel stabby. It might feel really achy in the lower abdomen. You might feel it in the labia majora or like your actual labia of your vulva or like where your vagina is, right? Because that's where those ligaments innervate or they connect to. So this stretching pain, let's talk about why it happens, all right? So if you're feeling any of those sensations occasionally throughout your pregnancy, what's happening is pre-uterus growing, all right, we have our ligaments. If you look at this is about the size to suspend. It's gonna connect deep in my like crotch area. If you can see this, I don't know if you can. If you can't, you'll still get the idea. So it's deep inside. It's connected with smooth muscle fibers, which gives it a little bit of stretch, but in general, the purpose of it is to hold things in place. So we don't want it super flimsy and super stretchy. And so during pregnancy, what happens is it's connected down here and then the uterus starts to grow and then it grows and then it grows and then, oh my goodness gracious, it is so tense and tight and so stretched out compared to what it really should be. And so you can imagine when your ligaments are that stretched out, when that's not necessarily their intention, it's a recipe for potentially some discomfort. It's also important to know where this is happening, right? So it's gonna go and it actually connects to your labia majora, which are like the outer lips of your vagina. And so with that, you might actually feel in the vagina that there's some like aching pains, or like my vagina just kind of aches, or there's sharp pains down there. Sometimes lightning crotch. I talked about lightning crotch in a super long ago, Coffee and Questions, but you get the idea that there's like sharp pains along your groin muscles or along the lower abdomen. Sometimes it's one-sided, sometimes it's double-sided. It's because your body is doing a whole lot of work to help suspend that uterus so that it doesn't move, but these ligaments get super stretched out. One thing that's really important to distinguish is this labor or even a preterm labor? Because we gotta know that. Or is there something else going on? Now, most of the time, what it sends people to the hospital with, they think that they're in labor, they think they have contractions. So this is where I'm gonna send you to my what is labor, my sure signs of labor, my what is contractions, my when to go to the hospital. I have so many different videos that describe contractions in different ways for you to know, but the sort of the like short version of it is that they come and they go away, that you have this gradual increase and tightening in the abdomen. It could be lower back pain for preterm if you're before 37 weeks, but it comes and then it goes away. And you may have those occasionally, but if they become to have a pattern, or they're like, wow, they're really strong now, and you start timing them, you have like more than 6 in an hour if you're before 37 weeks, that could actually be labor. But that's different than the like acute once in a moment, like, oh, or a constant dull achy pain in the groin area / the lower abdomen on the sides of your abdomen, because they connect to the top part of the uterus. So it's kind of anywhere along those sides, and there's two sides to it, okay? Could be both sides, could be one side. The question is, what do we do about it? That's what everybody wants to know. So if you think logically about this, if we have something that's super stretched out and it's really tense, we wanna make less tension in these ligaments. We want to, it's almost like if you have a new hair tie or something, right? You get the new hair tie and it's super tight and you're like, oh no. And what do? You start stretching it to kind of soften it out and warm it up. The same idea exists for your round ligaments. So some heat can be really helpful if you're really having an issue. You could use maybe a crackable heat pad on your lower abdomen or wherever you're having that discomfort, or even an electric heat pad or a hot water bottle, or even a hot rag might feel good. The other thing is, if you have these round ligaments that are super stretched out and then you go to change a quick position, you're pulling really fast on a not warmed up ligament, right? Think about your muscles, that if you've been sitting all night and you kind of wake up, you're kind of like, oh, I gotta like slowly lift my body out of that position, kind of warm it up and get going. And so when you change positions, it's really important that you kind of change those positions, not super like, well, I'm jumping up. You slowly will roll to your side. You slowly kind of get moving to warm those ligaments up. Along those same lines, if you think about softening out, we don't want tension in these ligaments. And the less movement, the more tight and kind of constricted those ligaments get. And so what do we need to do? Some movement or some exercise, some stretching. Prenatal yoga is like the best recommendation I make for all pregnant people, whether you're working out or not. Prenatal yoga is pretty like mellow version of yoga. You're not like standing on your head for hours a day or something, okay? It's super passive. It works on your breath, and that breath work with those slow changing positions where you're softening out these ligaments so that they're not so tense, okay? The other idea I have for you that I usually recommend for around ligament pain is an inversion. So I actually talk about this in my How to Turn a Breech Baby video. Now, you're not upside down or leaning like even like in a butt up puppy pose position where you're like on all fours with your butt in the air, kind of flipped upside down. That just kind of shifts the weight of the uterus, because what's happening is when you have these round ligaments that are super stretched and holding in place here, right? That what on that bottom part of the ligament, it just gets strained. It's a lot of weight from gravity of life. And the moment you flip it upside down, there's relief on that bottom part of the ligament. And so it can kind of just reset itself. So when you come up, and we're talking upside down with your butt in the air for like 3 breaths, okay? That's all it takes. Now, when you're upside down in that position, I want you to really relax your body and really soften and focus on like slow in, 2, 3, out, 2, 3 type breaths. These aren't like, and you're done. You wanna really like breathe into it and like settle into that, okay? Some other things that you can do would be a support belt. If you're feeling like you're having to support your belly like I talked about, or you're feeling a ton of that round ligament pain, a support belt can help you. I will link a couple options down below for you to check out just to add that added like pressure so that it doesn't feel so stretched out in your lower abdomen. A dietary recommendation that I have for you is actually taking collagen. So you wanna check with your providers whenever you're ingesting anything, use at your own risk. One of my favorites is Vital Protein. So I actually add that to my coffee every morning because collagen helps to create structure in the body, right? And when you're pregnant, you have this extra elastin in your body, which is like, think of like elastic. It makes everything a little bit softer, which we like for the baby fitting through the pelvis and for expanding that needs to happen. But we also need that structure and that added support. And so increasing some collagen in your diet can be really helpful, or a collagen supplement. I will link some options down below for that as well if you're interested. And then there's 2 professional recommendations. 2 of my favorite things I recommend to all my personal clients, and that is prenatal chiropractic and prenatal physical therapy, specifically with a pelvic floor therapist or somebody that specializes in pregnancy, because they're gonna be able to give you some specific exercises. They're gonna be able to assess you and feel and know what's going on in your body. Is this really round ligament pain? Is there somewhere else that's constricted? And then balance the body. We want both the sides of your body and all of your structures healthy. We want them loose, but we also want them with support, right? There's that perfect balance of soft and firm, I guess, or like supported, right? And they're gonna be able to help you with that. And then the last suggestion I have for you is actually massaging the round ligament. So when you're feeling that pressure, let's say it's connected down here, all the way up here, supporting your uterus, right? If it feels really tense and tight, or you're feeling those sharp pains, you could try some heat with it. But then what you're gonna do, let's see if I have enough hands for this, okay, is just a gentle massage along the side of the round ligament where you're feeling it. Slow position changes, kind of moving around, getting on a birth ball, stretching out the sides of you to kind of soften those sides, and then really working your way all the way down to your groin, even on your labia along the way, to soften it out and really create that space so that those ligaments can do what they're supposed to do. It's okay that they stretch. We expect them to stretch and we love that structure, but we don't like when there's so much tension in them. And so we're softening it out so that it has a lot of elasticity rather than so much tension in there. Thanks everyone for being with me here today. If you want more from me, I have childbirth classes online, coping with labor class, infant safety CPR. Everything is linked in the description box down below. I hope this was super helpful for you. If you're having round ligament pain, let us know in the comment box down below. If you found any other remedies, you can share your experience with one another. I so believe in community and that we are more powerful and stronger when we're together, and that we have so much to learn from each other's wisdom. And so make sure you comment down below with what you've done or what else you've heard, with any other questions, comments, concerns, so I can come back in a future Coffee and Questions and answer your question here. Which leads me to make sure you subscribe down below so that you don't miss those future videos. Check me out on Instagram because there's lots of other things going on over on Instagram. And then until next time, don't forget to flex and flow, and I will see you soon. Bye. And welcome back to Why Am I Moving the Ball Around so much? One very common make sure you get yourself a Cozy Earth sweatshirt with my promo code. Okay, I am sweating so bad in my pits. I don't think I put on deodorant. Oh, ow! Oh no, too much. Oh, I do a lot of so I need like a different face. Oh, ouch! Ooh! Ooh! Ah! Ooh! Oh! That's enough, right? Okay.